are joining us in the middle of a tremendous surge and finding time to partner with us in finding ways to be more inclusive of NP and PA colleagues in the completion of POLST. I'm Susan Tolle. I chair the Oregon POLST Coalition and direct the OHSU Center for Ethics in Healthcare. To begin with, I have no disclosures. There is no conflict of interest. The Center for Ethics is the administrative home of the Oregon POLST program, and we do not accept gifts from healthcare industry sources. Our data is from Oregon, and Oregon's philosophy is that we share what we learn, and all that we ask is for appropriate attribution. I do not speak for the POLST Paradigm Office. Oregon separated from the POLST Paradigm in 2017. On our history page, you can find out more information about that. There has been some confusion because Oregon appears white on some national maps about the level of development of the Oregon POLST program. Oregon is the founding POLST program. We have the most advanced the most advanced POLST registry in the United States. Abby Dodson directs that registry, and we are also able to gather data as a result and know that over half of people who die in Oregon have a POLST form at the time of death. What is harder to know, because there are no randomized control trials, is exactly the degree to which POLST impacts the level of treatment. We do know that Section B is the workhorse of POLST. It has 3 elements. The first is comfort measures only, someone who wants to focus on symptom management. The second is limited or selective treatment. People want to go to the hospital if needed, but they would prefer no intensive care and no ventilator support or full treatment. And we do know that there are strong associations between where people die and what is marked in Section B of the POLST form. Oregon, as the founding program, created the Section B with those 3 elements. And most states have copied those 3 elements into their POLST form. Now to the meat of our program, the history of becoming more inclusive. This figure is something you can use and share. We paid for open access in the publication in the Journal of Palliative Medicine that appeared in mid-August. 30 years ago, a group came together in Oregon concerned about portability of orders from one setting of care to another, and designed the POLST form. At that time, scope of practice was much more narrow, and only MD and DO signers were authorized of the POLST program for our first decade. In 1995, Oregon began statewide use of POLST, and in 2001, Oregon was the first state to authorize nurse practitioners as POLST signers. 6 years later, in 2007, Oregon was the first state to authorize physician assistants as POLST signers. In 2009, Oregon established the statewide POLST registry, funded by the Oregon Health Authority and directed by Dr. Abby Dodson. The registry allows us to collect data, both quality data, and to know who is signing POLST forms and where. In 2016, CMS became more inclusive, and with regard to advanced care planning, included nurse practitioners, physician assistants, and clinical nurse specialists in the fee schedule related to advanced care planning. In 2018, Oregon was the first state through legislation regarding scope of practice in the Oregon legislature to authorize naturopathic doctors as POLST signers. In 2019, Oregon changed its POLST form for the 13th time and changed the name from Physician Orders for Life-Sustaining Treatment to the more inclusive name Oregon POLST, Portable Orders for Life-Sustaining Treatment. Let's look at how often advanced practice nurses in Oregon were signing POLST forms. Sophia Hayes published this article in the Journal of Palliative Medicine using Oregon POLST registry data. And we can see that there has been a slow increase in the number of forms signed by nurse practitioners in Oregon between 2010 and 2015. The average rate was 10.8% over this period of time, and it was slowly rising. We have now recently published what has changed in the last few years. This is the number of forms in 3 calendar years, 2018, 19, and 20, by the discipline of the signer that were entered into the Oregon POLST registry. We can see that the majority of forms are still signed by MDs, and there are more MDs than other healthcare disciplines. Advanced practice nurses are signing substantially more forms. Out of the 121,000 forms reviewed here, 22,000 were signed by an NP, 6,000 by PAs, and just under 100 by naturopathic doctors. Let's look at the most recent year for which we have full data. Nurse practitioners completed 21% of POLST forms. That's double the percentage for the year 2011, which was 9.4%. So what we're seeing is a substantial recent increase in the number of POLST forms signed by nurse practitioners. And we are not seeing the total number of POLST forms increasing over this period of time. So it's the proportion that's changing, less physicians signing, more advanced practice providers signing POLST forms. Physician assistants signed 3.8% of POLST forms during that 6-year period that we looked at earlier. And in 2020, signed 5% of POLST forms. There are substantially fewer PAs than there are advanced practice nurses with active licenses in Oregon. Naturopathic doctors completed only 99 POLST forms in the 3 calendar year period. That number is not increasing over the 3 years. 25 forms were signed in 2020. Let's look at some of the changes Oregon has made to be more inclusive. We have changed the name of the POLST form, and it is more widely known now as Portable Orders for Life-Sustaining Treatment. Some of our regulations continue to make reference to physician orders for life-sustaining treatment, but all of our educational materials include the new language. Oregon has allowed advanced practice providers, nurse practitioners since 2001, PAs since 2007, to sign POLST forms independently. Some states are requiring the addition at the very bottom of the POLST form for the supervising physician or PAs who sign POLST forms. Oregon reviewed that recommendation related to the proposed uniform document and reaffirmed that physicians' assistant ability to sign POLST forms without a counter signature of their supervising physician. The Oregon POLST Coalition believes that there are important people working in many different ways to assist in advanced care planning. And there are many people who help in preparing POLST forms who are not signers. But that if someone is a signer, then they should not be a preparer and need someone else to sign. So Oregon continues to list the disciplines who need to sign, and of course the signature, which can be electronic, is required of those who are authorized signers of the 5 disciplines in Oregon who can sign. I'd like to end my formal remarks with an apology on behalf of the Oregon POLST Coalition to our NP and PA colleagues that it took us so long to change the name of POLST to be more inclusive.